Well, this man is a miracle worker. Siragusa Vein and Laser Center can make huge changes to your confidence. They can actually reduce the appearance of spider veins, varicose veins, and so much more.
And this is Dr. Tiff Siragusa right now. Now, these type of veins issues can be kind of like unsightly, but also painful, right?
Yeah. Right, yeah. A lot of patients come in because they're unsightly, they're embarrassed, they don't want to go on their beach trips, they don't want to go to the pool. But most often, they come in because they have leg swelling, skin changes that can range from just dark patches of skin to ulcers, and also just pain at the end of the day.
Yeah. Okay, I want to start with the varicose veins. We have some really powerful before and after photos, and I want you to walk us through these procedures and how it's done.
Sure.
So here's the first before. What's going on here?
So what happens to form these varicose veins is that the valves inside of the vein stop working. The valves are what promote the blood flowing upward back up to the heart. When those valves fail, blood just pools up in the veins, stretches them out, and dilates them like this.
Oh, wow. Okay. Yeah. I want to see that after photo. Oh, look at that.
Wow.
I mean, you can't even see it. How long did this treatment take?
This was about an 8-minute procedure in the office.
8 minutes?
That's it?
Yeah, we do it all under local anesthesia. We put a little laser fiber in the vein that has the bad valves, seal that off, and then do some injections into the bulging veins, which causes them to shrink up over about the course of 3 to 4 weeks.
Oh my gosh.
And it sounds kind of like the one-stop shop. So what's the, as far as like, you know, recovery time, what does that look like?
So recovery time, there's not much, not many restrictions. So patients have to wear a compression stocking for about 3 days after the procedure.
Okay.
Just during the day, they can take it off to sleep.
Yeah.
No squatting or lunging or really heavy, intense leg exercises for 3 days. But they get back on the treadmill. I encourage them to walk as much as possible, even the day of the procedure. A lot of patients go. We've had patients go do concerts and go play golf like literally right after their procedures.
No kidding. Okay, see, miracle worker, as we mentioned. And I know that you were...
I was curious about the insurance thing because it looks awesome, but you know, I'm sure people at home want to figure out if their insurance will cover it.
Yeah, and this is a very common misconception, even among doctors, as far as how do you get your veins covered.
Yeah.
So varicose veins are pretty much always cosmetic in that they're visible. But at a certain point, they start causing pain, swelling, difficulty just carrying out activities of daily living. Once it hits that level, insurance considers it a medical problem, a circulation disorder, and they realize that it will only get worse and progress to skin problems, ulcers, which are even more expensive and costly to treat. Yes. So all the insurance companies have their own specific guidelines for what they will approve. Yeah. And we have an insurance specialist that's her job. All she does is work with insurance companies.
And by the way, you can use this QR code, and this is really cool. Dr. Tiff, I know that you work with people from all over the country, really. So let's say you're out there, you're watching this, you've got your phone out, you're visiting. Snap that QR code because you help everyone. That's where you can find out if your insurance does cover this procedure, correct?
Right, yeah. Even as a doctor, insurance policies confuse the heck out of me. Yeah. So we have a system in place to help patients navigate through their own personal policy to figure out, A, are varicose veins covered by this policy? And B, would they meet the criteria set forth by their insurance company?
Okay, very good.
What about spider veins? What's that? I mean, I hear that term a lot.
Yeah, so spider veins are a little bit more common. They don't necessarily indicate an underlying circulation problem. They're usually cosmetic. Those are typically treated with injections. Sometimes you can treat some of the smaller ones with lasers. But most spider veins are better treated with injections. So
this picture, okay, before and after, obviously before on top and the bottom. Again, walk us through this. How long did this take? Was there any downtime?
So this patient came in pretty anxious because she has all those veins that are just look like pretty separate veins on that top picture. But what I do is I use an ultrasound to find a feeder vein, which is like a trunk that feeds into all of them. You can see at the top of that top photo, there's a little needle. So that one needle was stuck into the little feeder vein. I did one injection and got the result that you see on the bottom with one injection. That took about 1 minute.
No kidding. And I know that this is cosmetic, so I don't think insurance covers it. However, you do have a 2-for-1 deal for spider veins, which is fantastic.
Yeah.
Very good.
So fall's the best time to do this because the veins that you treat for cosmetic reasons actually look a little bit worse before they start to look better. Okay. So once people get their jeans out, their leggings, their boots, and they can hide their legs and they're not worried about being hot, this is really the time to get your legs set up.
Because you want to love your legs again.
That's right.
I know that saying. Yeah. All right, thank you so much, doctor.
Thank you, Laura.
All right, this QR code right there on your screen will take you right to their website. You can make an appointment and find out everything that they have to offer. Visit NashvilleVeinCenter.com.